100 years has turned a lot of his interest, personal interest and research into pain and pain management and so forth. And he's met a lot of great people along the way, like Dr. Eli. And so we're very excited that Dr. Cook made the introduction to our company here recently. And, Dr. Cook has taken some pretty strong positions in our company as far as, he's really dedicated, committed to seeing Nyloxin become the premier product in the over-the-counter market. He's done his research, several months worth of research and due diligence on our company to the point he would feel comfortable enough to share our opportunity, our product with one of the premier pain doctors in the country, with Dr. Brad Eli. So I'm going to let Dr. Cook go ahead and make his formal introduction tonight, and then we'll be happy to have Dr. Eli come out and start sharing with us this evening. So, Dr. Cook, are you there with us tonight?
Yes, sirree.
Well, take it away, my friend. Please go ahead and share what you love to share about Dr. Eli, and we're anxious to hear from him tonight.
Well, thank you, Mr. President. I appreciate all your efforts. And, wow, great excitement. Welcome everybody on the call. And it's special tonight because we're honored to have my good friend and colleague, Dr. Brad Eli, as my Nyloxin special guest speaker tonight. So Dr. Eli is the founder and director of the San Diego Headache and Facial Pain Center in Encinitas, California, where he has developed a multidisciplinary approach in treating both acute and chronic orofacial pain, including migraines, stress and tension headaches, myofascial pain, neuralgias, TMJ jaw disorders, burning tongue syndrome, central nervous system pain, and head and neck injuries. So after completing his dental training in Philadelphia, Dr. Eli completed a 2-year residency in orofacial pain and dysfunction at the prestigious UCLA Pain Management Program. He is also a diplomat of the American Board of Orofacial Pain, and I know how difficult that is to attain. He has taught at several universities and is on the staff at the University of California San Diego Medical Center, as well as 3 Scripps hospitals in the San Diego area. So with over 25 years of unique clinical and didactic experience, Dr. Eli is well versed to discuss pain disorders. He is in the trenches, so to speak, treating pain patients every day. Dr. Eli is also an accomplished private pilot and has several inventions in the field of pain and sleep disorders, and he continues to do research in those fields today. So again, we are honored to have you join us tonight, Brad. So please share your Nyloxin experiences with us and tell us how you've utilized the product. Go ahead. You got the floor, man.
All right. Thanks so much, Ron, and thank you, everybody, for your respect and giving me the honor to talk to you tonight. I am really overwhelmed by the outpouring. Dr. Cook was kind enough to bring this product to my attention approximately 2.5 months ago. And 2.5 months ago, prior to that, I never heard of my Nyloxin. I never knew what Cobroxin was. I never knew anything about this product or its availability, its bioavailability, its method of action. 25 years ago, oh my God, I think about that and I think, where did the time go? But for 25 plus years, I have been coming to work every day to see the patients that everyone in practice thinks of and thinks, oh my God, I don't want to see that person anymore. As a matter of fact, when I first started in practice, that was how I started my practice in San Diego. I literally went to 100 doctors' offices and I said, my name is Brad Eli. I am an expert in head, neck, and facial pain. Look through your daily record and think about the person that you never want to see again. That's who I will take care of. And the rest is pretty much history. We've been able to grow our business every year by 20% over the last 25 years. We felt little change during the economic crisis because of what we take care of. It seems as though pain doesn't sleep, and that there is no truer statement than that. So every morning I get up and I get in my car and I drive to an office where I see somewhere between 20 and 40 patients whose chief complaint is pain. The word pain is the most commonly sought after treatment descriptor used by patients. So 90% of all doctor visits in the country are because of the word pain or a symptom of something else that is painful. So when you think about the numbers of doctor visits there are, and you take 90% of that, it's a pretty good sized chunk of people. Over the last 25 years, the people who have not been in the pain field have probably been unaware that we have seen a violent swing in the pendulum of pain and pain management. In 1992, when I graduated from the UCLA program, I was given an academic appointment at 2 university hospitals in Southern California to become an educator for doctors taking pain fellowships. So all the doctors out in America who are anesthesiologists or physical medicine or rehabilitation doctors or neurologists who were going through a 1-year pain fellowship program to become a pain expert were educated in head and neck pain by me if they went through the Loma Linda program or the UCSD program. Unfortunately for them, their program is 1 year long, and during that 1-year fellowship, they are expected to learn all there is to know about the word pain and all of the procedures that are associated with pain. Unfortunately, more than half of all pain visits to pain centers in America do not involve head and neck pain, but rather back pain and other such disorders. So a lot of the people who are the pain experts in your town or your borough are not necessarily going to be experts in the field in which I'm an expert in, and vice versa. Once out in practice, I spent 10 years in that educational position and program, and during that time, we saw the growth of the decade of pain, it was called. So when I graduated from my program, I had the equivalent of approximately 2,000 hours of didactic and clinical training in the word pain. When the medical students coming out of UCLA graduated in 1992, after 4 years of medical school, they had 4 hours of training in the word pain. So just to give you a reference point of the educational requirements for physicians at the time that we got started. During the next 10 years was focused on educating people within the healthcare field to adequate control of this word pain. And what we saw was a rapid upswing in the number of prescription drugs being delivered to the patient population under the auspices of pain control is what is important, and the type of pain control that you used was not as critical as getting control of that pain. Now, just for your information, this was all based largely on some very good research done by a psychologist who happened to be my mentor when I went through UCLA, and he wrote a article in the magazine Science, which was titled "Pain Can Kill." And what he showed is that uncontrolled pain compromises the immune system of, in his research, laboratory rats. So he had two groups of rats. He injected them with tumor cells that they knew would cause tumors to grow in the lungs of the rats. He took one group and swam them daily in ice-cold water, and he took the other group and he controlled all of their stress by keeping them comfortable, giving them as much food as they wanted, and making their life very comfy. And what he showed is that stress compromises the immune system and the ability for the body to fight off, in this case, tumor growth. And therefore, his proposal was uncontrolled pain was very stressful to human beings. Therefore, by not adequately controlling pain, you actually allowed the patient to get worse quicker. And therefore, that is where this all really started. So you saw the development of hospice and the concept of not having ceiling doses. I know I'm getting over some people's head here, but there's a phenomenon known as ceiling doses, and that is the dose at which narcotics no longer provide adequate pain control. So there was no ceiling dose on opiates or narcotics that did not have Tylenol in them, and therefore, through hospice care, patients were getting massive doses of narcotics for pain control. Well, over the years, that morphed into, if it was good for people who were dying of cancer, why wasn't it good for the people who were still having to live? And therefore, we had what we call drug creep occurring in the pain field, where physicians who really weren't trained in pain were seeing patients come back to their practice on large doses of morphine, large doses of Dilaudid, large doses of other potent analgesic agents, and therefore there was this general consensus that, hey, there's no risks here, and if you can make a person more comfortable, you should. And just to let you know how really strong that lobby was, there was actually a number of lawsuits filed through the 90s where patients sued their doctors for inadequate control of their pain by not prescribing an adequate amount of narcotic. So here we are in 2014, and the pendulum, just like it does in a lot of fields, is swinging backwards, and it's swinging backwards hard and fast. Now we're hearing and reading on the front page of the USA Today that the Nyloxin people are making sure that we know about, hey, pain and the indiscriminate use of opiates or narcotics is terrible. People are getting addicted to the drugs, and this is terrible. And therefore, what a great opportunity for Nyloxin, and I must agree 100%. There could not be a better statement made than the statement that says that if you can adequately control a patient's pain with a non-narcotic alternative that is way over the top, i.e. a homeopathic agent, that a person can access by themselves on their own. You give complete control to the patient. You give the right to take the pain down or away when the product works for them, and you give them exactly what the study that pain can kill takes care of, and that is reducing the stress associated with uncontrolled pain by giving the person the opportunity and the access to the opportunity to control their pain. So 2.5 months ago, Dr. Cook calls me up and says, hey, I got this new product that blah, blah, blah. Well, let me tell you all that this not the first time that I've heard there's this new magic pill/product that's coming out that's going to cure pain. So I literally took that statement with the biggest grain of salt that I've ever taken, and I said, how does it work? What is it made of? And everything else. To which I got some answers, but those answers were not exactly convincing me. So I said, Dr. Cook, or in this case, Ron, I said, Ron, if it's really that great, I see 20 to 40 patients a day. These are patients who, by definition, have pain as their chief complaint. And the average patient that I see has seen 7 to 10 providers prior to me for whatever it is they're here for. So if you are so sure that this product works so well, send me some bottles of it. I will hand it out, and I will believe it if I see it. So Ron, being the optimistic guy that he is, said, fine, if that's what it's going to take to convince you, then fine, I will send you. So he sent me 30 bottles. This was not a minor investment on the part of Dr. Cook. But he sent them to me and said, you know what, I want you to be convinced and try it, and however you want to use it, use it. So I got the 30 bottles, and I was the absolute biggest non-promoter of my Nyloxin that you've ever heard in your entire life. I walked into 30 rooms, not one right after the other, but I walked into rooms with patients in them, and I said, this is a new product that's only available online. I have no idea if it's going to help you. I need you to apply it to wherever you have pain 4 times a day. And that is the way I sold the product to the patients. And I thought to myself, yeah, right, this is going to work. And I rescheduled them all for a week later. So a week later, my assistant comes to the door because she seats the patient and gets an updated health history on them before I come in and see them. And she comes to the door and she said, hey, we got our first Nyloxin patient back today, and they said they think it works pretty good. And I said, oh, really? So I came in and I said, oh, I gave you that stuff. What did you think of it? And they said, I feel much better. When I put it on, I felt great. So very soon, in 1 week, as a matter of fact, I went from 30 people who I had an option of giving a narcotic to, or continuing them on a increasing slow creep narcotic dose, or a person who had a refractory muscle problem, let's say, to, I would say safely, 80% of the people that we saw said it worked. And so I thought, that's pretty interesting, because I can't remember the last time I saw 80% of the people come back and tell me something worked, number one. Number two, it didn't have any odor. Number three, it didn't have any side effects. Number four, it didn't have any contraindications with other drugs. Number five, they could order it by themselves online. Number six, it cost on a monthly basis less than the person's copay and the amount of fuel that they spent driving to and from my office. So to say I was impressed is an understatement. I was quite impressed. And I was impressed enough to, like Dr. Cook, bring it up to some colleagues of mine who promptly told me I was full of shit and they'd seen a lot of great products come along and they didn't believe me. And, if I was so sure, then I should, prove it to them. So let me start by saying I've never seen a product like this in 25 years of practice. The second thing I can tell you with confidence is there is no other product in the marketplace that I'm aware of that is as effective as this product is in the method of delivery that this product is at the speed at which this product works. I now have quite a bit of experience with this product, and I will tell you that when using the gel or the roll-on topical, if the patient responds, they will respond likely within the first 15 minutes after they use it for the first time. And that has been present in a large enough number of people that I now, today, remember that I put it on 90% of the people that I saw at the site of their pain during their visit at today's visit. And the reason I do is because if this works, this is a true no-brainer. This is a truly remarkable miracle that is available to the population. And I can say without reservation that this product, if this product doesn't go viral, it will be nothing shy of a miracle. I believe this product, once it gets in the hands of the people who have debilitating pain problems like trigeminal neuralgia. I see a disorder called trigeminal neuralgia. This is also known, and everybody should look it up after we get off this call. Trigeminal neuralgia is also known as the suicide disease. That is because the pain intensity is so great that patients prior to us having alternatives in treatment used to just simply kill themselves because it was so violent and so uncontrollable, and their life was so miserable with it that they preferred suicide to living with it. Now, granted, we have other treatments now. We have a treatment that I provide right now for trigeminal neuralgia in which a patient comes in and they get an injection of anesthetic and steroid on a weekly basis for 5 weeks in a row. During the same period of time, they're placed on an anti-seizure drug that they slowly increase the dose on until they become pain-free or they can no longer stand up. Now, I say that kind of smiling tongue-in-cheek, but the reality is that is a true reality, that these people have really no choice. They either will get control of the pain or they will not get control of the pain. And if they don't, their life is over as they know it. So I had a gentleman who was on his third injection. I had seen him previously about 2 years ago. He had trigeminal neuralgia. We gave him the oral spray, and approximately a week after he started that spray, he started to notice a significant difference in the trigger ability of this phenomenon known as trigeminal neuralgia. Now, the reason why that is so significant to me and should be to all of you is because he had not been responding as well on this time around treatment-wise. And therefore, he was 2 weeks away from being referred to a neurosurgeon for an irreversible surgical procedure in which they cut a little window in your skull and do brain surgery on you, or they put you in a custom-made headdress which holds your head in a specific position while they use a radiation source known as gamma knife therapy in which they burn the nerve to get this pain under control. What does that procedure cost? $50,000 plus. How reliable is it? Approximately 80 to 85%. How many people need it done more than once? probably about 40% of the population who have to have it done more than once, and totally irreversible. I'm sitting and I'm looking at a gentleman who's an ex-Marine who's telling me that 2 weeks after I started him on a spray that he puts in his mouth of snake oil, he's pain-free. And that was the alternative to a $50,000 procedure that was irreversible. Ladies and gentlemen, that catches anyone's attention who's in this field. And I can say with no doubt in my mind that if the Trigeminal Neuralgia Association of America, which there is one because it's that bad, gets a hold of this, what do they have to lose to try it? What is the downside for somebody to try the drug and the product that we have? So these are the things that we are running into on a daily basis now. I can say without a shadow of a doubt, number one, that my staff and I now are more surprised when a patient doesn't respond to Nyloxin than when they do. Number two, venom as a treatment is not so out there. It's been around for a long, long time. It's just no one has taken it through all the hoops and, I dotting, T crossing like Rick has done now. And he's put it in the hands of people, and the smartest thing that I think that this company has ever done is not put millions of dollars of product on the shelves of drugstores all over America, because doctors all over America will not just believe you, because it's unbelievable what this product does. So the long and the short of this comes down to the reality that you have now the ability to give a patient a product that they can completely access on their own. They can try it. If they don't like it, it's like playing the lottery. And if you don't win, you get your money back. I mean, it's the most amazing, ridiculously obvious choice that there is. And to not try people on this product is going to be the biggest mistake that a lot of doctors are going to make. But I think we all have the opportunity to help educate the doctors in America and the healthcare providers, the allied healthcare providers, the doctors of chiropractic and the doctors of acupuncture and the doctors of the ancillary type of providers, the holistic practitioners of America. These are people who see just as many pain patients as I do as a dental pain specialist, and my colleagues who are anesthesiologists see as medical pain specialists. So this is a very powerful product. I think that the opportunity that's been given to all of us is very unique. How much do I believe in it? I believe in it strong enough to have myself as a gold member, my daughter as a gold member, my other daughter as a gold member. I'm thinking about signing my dog up as a gold member. And, that's about as much as I can. With the Pain Away Pep product, I don't see the future of my practice going to the dogs, so to speak, but, I didn't see myself as a snake oil salesman 2.5 months ago either, and I am now. So with that, do you have any questions? What else can I tell you? I mean,
yeah,
it's a miracle. It is a miracle.
Wow, Dr. Eli, you made it very hard for me tonight to ask you any questions because you were so thorough in that. In your talk tonight, you covered all the bases of things I wanted to ask you about. You covered it in your talk, so you made it very hard for me to come up with some really good questions for you. But what an amazing story, testimony, just your endorsement on the product. It's just awesome. It's just incredible. And thank you very much for agreeing to come back tonight. I know we've got a record audience on tonight to hear you. So people really enjoyed you on Tuesday, and they came back in full force again tonight to hear it a second time. So we do thank you again. But we've got a couple of questions we do actually want to bring out to you. And, if you are, now that you are sort of, I guess, knocked off the cart a little bit about Nyloxin because, you've had this experience with the product, and it's kind of taking you aback a little bit professionally because, doctors I know probably at first glance are always going to sort of poo-poo an over-the-counter snake oil, snake venom product because it's just the way the reality is in that field, but when you have these other drugs. But now that you've had this sort of experience with the product and it sort of has given you a different perspective, and I know we have other doctors listening tonight. I know we have chiropractors on the line. I'm sure we have pharmacists on the line. I'm sure we have all kinds of people that are, are also in the medical field. I mean, so people that you'd probably say are peers to you in this industry that you're in the medical field or the pain market. What do you say to a person like that? I mean, what would you recommend a Nyloxin independent entrepreneur say to their doctor about this product? I mean, how would you address somebody in that field if you were trying to explain to them why this thing is so amazing? What would you say?
I would point out to them that that describing it as snake oil or venom is really not a very big reach when you consider that morphine is the sap that oozes out of a poppy that's grown in Afghanistan, and some of the most potent analgesic agents on the planet are snail venom. So it's not, it didn't take me long to accept this as being possible because of my understanding with where the other products come from. What is difficult to understand, and you will not convince, I think, very many doctors until they get it in their hands and use it, is how quickly it works, how consistently it either works or it does not work. And that is really critical. A friend of mine who is a professional sales guy told me a long time ago that a good salesman just simply wants to hear, is it yes or no? You just want to know if a person doesn't have an interest in learning. If they do not have an interest in learning, don't try to convince them. It's too time-consuming. You won't change their heart and mind by convincing them if they start out by being a doubting person. If they start out by being a person who's open to the concept, then don't try to convince them. Leave them a bottle. When I went and picked up some medication the other day, and I was talking to the pharmacist, and I was just reviewing with him. I said, have you ever heard of this before? And he said, no. And he looked at it, and looked at the box, and he said, wow, homeopathic. And he looked at, Asian snake oil. Wow, that's weird. And I said, you're going to hear about this product. I said, this is the most amazing stuff that I've ever seen, and I have seen a lot of stuff. And he said, really? And I said, yeah, when I get my next order, I'll bring you a bottle and just have it behind the counter here. And, if somebody comes up to the counter and has an ache or a pain, just wipe it on them, then let them go pick whatever they want and just come back to your counter before they leave and ask them if it's better. And look, if it's better, they'll know right then. I've started taking little videoettes with my cell phone on patients who have said, yeah, I came in here, my head was a 7 out of 10. 10 minutes ago, you put this stuff on my temples, and you told me it was snake oil after after we're making this video, and it's a 1 out of 10 now as opposed to a 7 out of 10. I mean, it's crazy. It is absolutely the craziest stuff I've seen ever. And so understand that the story is crazy. The story is unbelievable. So don't try and make somebody believe it. Just let them see it. And seeing is believing in this product, absolutely. And with a company that's backing it like you guys are, which is that play the lottery, if you don't win, we get your money back. I mean, come on. Who's not going to do that? Only the people who are pig-headed, only the people who are doubting Thomases, only the people who think that they know it all. So I've just described myself to a T, okay? And Ron will attest to that, absolutely.
Well, Dr. Eli, I can tell you that this has been valuable information that you're sharing with our team tonight, and we've got a lot of fired up people here that I know the minute we're going to open up these phone lines here in about the next 20 seconds, they're all going to shout out their thank yous tonight, because I got phone call after phone call, text messages, emails. I had everybody after me on Tuesday for the recording, and our recording, unfortunately, didn't work out for us. So I know there's going to be a lot of happy people tonight when they get this recording in the morning. And I, on really behalf of all of our corporate team and our MIEs, we really, truly do thank you for being willing to come back tonight and share. And we're excited that you're a gold member. Like, you're not just a doctor giving an endorsement because we asked you to. You're actually you're as much of a believer that you put your own money into the company, that you're a gold member, and much of your family is as well. So
I'm taking full advantage of the MID program as well. So please, if you're not a gold and on board with what this company is doing right now, you have your head in the sand, and you expect to get in on Apple Computer after it becomes famous. So, it's the wrong time to get on board once the message is out. I think it's, one of the things that I want to say, and I didn't mention it today, but, in my practice today, I wrote no fewer than 20 prescriptions for narcotics. You have to understand that narcotics do change people's lives for the better. So the goal is not to eliminate narcotics from the picture, because they are positively life-changing drugs for a lot of patients. But if you can put this on board in a patient as an alternative, or you can put it on a patient who is currently taking a narcotic and they can start to control their pain better and lower their narcotic dose, then great. That's what you want to do. And the ability of the doctors who don't have prescribing privileges, then it's a huge plus. The chiropractors, the acupuncturists, they see just as many pain patients as we do, and not having prescribing privileges is a pain. But the reality is now you have something to offer, and you know what? Offer it, because you will be shocked at how well it works.